Cancer symptoms are easily confused with other diseases. The signs of cancer are often nonspecific and easily confused with common diseases, leading to late diagnosis. Early recognition of potential symptoms and medical examination are very important. Below are common signs of cancer that are easily confused with other diseases. 1. Persistent fatigue. Cancer signs. Unexplained fatigue that does not improve with rest can be seen in diseases such as leukemia, colon cancer, or lung cancer. Confused with stress, lack of sleep, iron deficiency anemia, or physical weakness. Note: if fatigue lasts more than 2 to 3 weeks, accompanied by symptoms such as weight loss, low-grade fever, or unexplained pain, you should see a doctor and have a blood test, CBC, CRP, or X-ray. 2. Unexplained weight loss. Cancer sign. Losing 5 to 10% of body weight in 3 to 6 months without changing diet or exercise, often seen in stomach, pancreatic, lung, or colon cancer. Confused with diabetes, hyperthyroidism, digestive disorders, such as chronic diarrhea, or stress. Note: if weight loss is accompanied by loss of appetite, bloating, or changes in bowel habits, a gastroscopy, colonoscopy, and cancer marker tests, such as CEA, CA 19-9, are needed. 3. Persistent pain. Signs of cancer. Dull or severe pain of unknown origin, especially in the bones, bone cancer, bone metastases, abdomen, liver, pancreatic cancer, or head, brain tumor. Confused with arthritis, muscle pain, stomach pain, or tension, headache, migraine. Note: pain that does not subside after taking common painkillers, paracetamol, ibuprofen, lasts more than 2 weeks, or is accompanied by swelling, fever, requires CT scan, MRI, or blood test. 4. Prolonged low-grade fever. Signs of cancer. Low-grade fever, 37.5 to 38 degrees of unknown origin, often seen in leukemia, lymphoma, or liver cancer. Confused with viral infection, flu, dengue fever, tuberculosis, or common infections. Note: fever lasting more than 2 weeks, especially in the afternoon, evening, accompanied by fatigue, night sweats, or enlarged lymph nodes, requires blood tests, chest X-ray, or abdominal ultrasound. 5. Change in digestive habits. Signs of cancer. Diarrhea, alternating constipation, bloating, or feeling of incomplete bowel movement may be colon, rectal, or stomach cancer. Confused with irritable bowel syndrome, IBS, colitis, or digestive disorders due to eating. Note: symptoms lasting more than 3 weeks, accompanied by blood in the stool, pencil-sized stools, or weight loss, require colonoscopy and fecal occult blood testing, FOBT. 6. Persistent cough or shortness of breath. Signs of cancer. Persistent cough, hoarseness, or difficulty breathing may be associated with lung, laryngeal, or compressive thyroid cancer. Confused with bronchitis, asthma, allergies, or respiratory infections. Note: coughing for more than 3 weeks, especially with blood in the sputum, chest pain, or neck lymph nodes, requires a chest CT scan, chest X-ray, and cancer marker testing, such as CIFRA 21-1. 7. Skin changes. Signs of cancer. Moles that change color, size, or shape, skin cancer. Yellow skin, liver, pancreatic cancer, or rashes of unknown cause, lymphoma. Confused with allergies, eczema, dermatitis, or jaundice due to viral hepatitis. Note: moles with diameter 6 mm, asymmetrical, bleeding, or yellow skin with abdominal pain require skin biopsy or liver ultrasound, liver function tests, ALT, AST, bilirubin. 8. Abnormal bleeding. Signs of cancer. Blood in stool, colon, rectal cancer. Blood in urine, bladder, kidney cancer. Vaginal bleeding outside of menstrual periods. cervical cancer, endometrial cancer. Coughing up blood, lung cancer. Confused with hemorrhoids, urinary tract infection, menstrual disorders, or bronchitis. Note: any persistent or recurrent abnormal bleeding requires endoscopy, ultrasound, or specialized testing, such as PSA for prostate cancer, CA 125 for ovarian cancer. 9. Abnormally enlarged lymph nodes. Signs of cancer: swollen lymph nodes in the neck, armpit, groin, painless, not disappearing after 2-3 weeks, can be lymphoma, breast cancer, or metastatic cancer. Confused with infection, pharyngitis, tooth abscess, or common lymphadenitis. Note: if the lymph nodes are hard, immobile, or accompanied by fever and weight loss, a lymph node biopsy and blood tests, LDH, beta-2 microglobulin, are needed. 10. Difficulty swallowing or bloating. Signs of cancer: feeling stuck in the throat, difficulty swallowing, esophageal, stomach cancer, or prolonged bloating, stomach, pancreatic, ovarian cancer. Confused with gastroesophageal reflux, GERD, gastritis, or irritable bowel syndrome. Note: symptoms lasting more than 2 weeks, accompanied by weight loss, vomiting, or abdominal pain, require a gastroscopy and general abdominal ultrasound. Important note: do not self-diagnose. The above symptoms may be due to benign diseases, but if they last 2-3 weeks, recur, or are accompanied by many signs, weight loss, fever, pain, you need to see a doctor immediately. Cancer screening. People over 40 years old with a family history of cancer, or at high risk, smoking, obesity, should have regular screening. Gastroscopy, colonoscopy, stomach cancer, colon cancer. Low-dose CT scan of the lungs, lung cancer. Breast ultrasound, Pap/HPV test, breast cancer, cervical cancer. Blood test for cancer markers, CEA, AFP, PSA, CA 125. Healthy lifestyle: reduce the risk of cancer by quitting smoking, limiting alcohol, eating lots of green vegetables, exercising, and maintaining a reasonable weight. Thank you for watching the video. Wish you and your family health and happiness.